Warning: the following discussion involves a topic that can be deemed both sensitive and controversial to some members of our audience. During this presentation, we aim to provide a discussion that focuses purely on the ethical issue itself, not an expression of our own personal views.
Prenatal genetic testing is a range of tests that screen for or diagnose fetal abnormalities such as Down syndrome, neural tube defects, and genetic conditions. The scope of testing involves screening, which identifies risks of defects, and diagnostic, which tells you if the fetus does have a defect. Testing can be invasive, such as amniocentesis tests, which draws fluid from the amniotic sac, or testing can be non-invasive, such as ultrasound scans to identify structural anomalies such as spina bifida. Itself is an ethical issue due to the extensive ethical dilemmas that arise from testing and the results. Prenatal testing is an ethical issue because it offers women choice through autonomy. Autonomy means that women have the right to choose how they reproduce and align reproduction to their values, morals, and wider contexts. However, choice comes with its own burdens, and what may be deemed right for one woman may be deemed wrong for another, and because of this, autonomy becomes burdened with consequence. Additionally, the scope of testing comes with ethical issues surrounding consent. The rapid integration of testing technology threatens to routinize testing. Invasive testing has sustained consent processes, as health professionals must ensure women understand the consequences and risks. However, for non-invasive prenatal testing, informed consent has been ineffectively established. Without informed consent, women may not be prepared for the implications that come with testing, and therefore it is unethical to engage with testing without first sustaining a level of informed consent. The variance in consent and integration of consent contributes to the ethical nature of prenatal testing.
The public health rationale focuses on the burden to society if a fetus is diagnosed through prenatal testing with a debilitating condition and the potential healthcare costs associated with bringing a severely disabled child into the world. The public health rationale aims to reduce the incidence of many conditions that aren't compatible with life. The public health rationale focuses on the burden to society if a fetus is diagnosed through prenatal testing with a debilitating condition and the potential healthcare costs associated with bringing a severely disabled child into the world. The public health rationale aims to reduce the incidence of many conditions that aren't compatible with life. The lifetime costs associated with caring for a child or an adult with a severe disability impacts on society's healthcare system, as well as putting financial strain on the woman and her family. From the public health rationale perspective, a positive result may lead to a future where the quality of life for the baby is significantly reduced, with the child becoming a burden on the family and society. Within this rationale, the ethics perpetuates that the cost of burden outweighs the benefit of the child's life, and therefore it would be not compatible to continue with the pregnancy. Many people believe that screening for certain conditions and disabilities is discrimination against the disability community and perpetuates a harmful message to the disability community that their life is not worth living. The public health rationale is closely associated with the ethical debate surrounding abortion, as many individuals see prenatal testing as trivialising abortion, and many people believe healthcare practitioners encourage abortion if the tests come back positive. Time costs associated with caring for a child or an adult with a severe disability impacts on society's healthcare system, as well as putting financial strain on the woman and her family. From the public health rationale perspective, a positive result may lead to a future where the quality of life for the baby is significantly reduced, with the child becoming a burden on the family and society. Within this rationale, the ethics perpetuates that the cost of burden outweighs the benefit of the child's life, and therefore it would be not compatible to continue with the pregnancy.
The ethics of the woman's autonomy focuses purely on ensuring the woman understands her rights and choices regarding her pregnancy, the nature of the prenatal genetic testing itself, and the options of different services that she can further explore if or if not a genetic abnormality in the fetus is present in the test results. With the woman understanding her rights and choices, this can assist her in making the most informed and beneficial decision that best suits her own individual beliefs, values, cultural, and situational background. Any autonomous decisions that the woman makes should be respected and understood by any and all healthcare professionals involved. However, it is important to note that the woman prior to any decision making has been provided with the chance to investigate her variety of options if, or if not, she was to terminate her pregnancy. In the 2017 edition of the New England Journal of Medicine, it was documented in the article of Supporting Women's Autonomy in Prenatal Testing that during the consultation period between the clinician and patient, time constraints and the possibility of the clinician's professional opinion showing bias could play roles in restricting the amount of information that is provided to the woman on potential genetic abnormalities her baby could carry. And furthermore, these restrictions could affect the woman's autonomous decision making. The ethical relevance beneficence has with prenatal genetic testing is that it allows the woman involved to distinguish the benefits, harms, and risks associated with birthing a child who is carrying a genetic abnormality. The benefits and harms involved in a situation like this for all women will be perceived differently given their own circumstances. There is a various sum of social, psychological, and physical factors that would need to be taken into consideration by the woman and all healthcare professionals involved in order to allow the woman to make the best, sound-minded, and informed decision for herself.
The ethical theory consequentialism focuses on an assessment of consequences both good and bad, advocating for the action that promotes happiness and the greater good. In prenatal testing, it is in our opinion that the mother's autonomous decisions should be respected and regarded as their cultural and situational background narrows the decisions to the actions of the fetus, whether it be to birth or terminate. This could be exemplified where a mother and father have struggled to start a family in the past, or they encompass strong negative values to the termination of the child, therefore shaping their decision to birth the fetus no matter the result of the prenatal test. Lastly, it is in our opinion that there is difficulty in ethics to assessing the fetus's genetic defect severity and choice of living. Depending on reasoning, it then becomes sensitive topic to the parent's tolerance for the quality of life of the fetus's birth defect, in which then affects its upbringing.
The ethics of prenatal testing is a very complex and in-depth argument that sparks a lot of emotion in many people. In this presentation, we have explored many ethical issues concerned with prenatal testing, such as autonomy, consent, beneficence, and the effects on society. Ultimately, it is the woman's choice as to whether or not they undergo prenatal testing and should be provided with all the information needed by the healthcare advisor so they can make an informed decision about what they believe is best for themselves and their baby.